So part 4 of what was going to be a part 1. I didn't know why. I thought I was be able to talk that stuff in 10 minutes. But anyway, okay, so part 4. So let's recap a little bit. So there was two phase 1 and 2, where it was the wound contamination and colonization. And now we were starting to talk about the critical care, the critical colonization. And critical colonization, some people call biofilm. And what they're discovering now is that it's a little bit like if the bacteria would be putting his rain jacket on. And now we're having more trouble. So some of the product, even if you're trying to use them and everything to try to kill the bacteria or something, they don't work. And so this is a new discovery. They're not a new discovery, they know it was there, but they're starting to discover more about what is actually, it's called biofilm. So, and I'll put a link down of a little bit of an information and stuff about biofilm. And so they're still discovering what that stuff is and how to fight it, because they're discovering that sometime at the top there's certain bacteria and inside is another bacteria, so they think it's a multi-colony. So it's a little bit like it's a little bit like if a bunch of bacteria would create like a village and then put like a big barrier all aside, and then when you're trying to attack, it doesn't work as well. And then the fourth one, this is where you get into your infection. And so at the biofilm phase, or the phase 3 on our graph here, there's not much we can do yet because they're not quite sure how it goes. But at the infection, this is when you have to start treating. So you see that there's a lot of steps before we start treating for infection. So what does that mean for us, and why I'm talking about that stuff? It's because a lot of people will put products on their wounds just so that they, I don't want my wound to be infected, I don't want this, I don't want that. But sometimes what is going to happen is that you're going to actually create almost, because if you create an inflammation process, so by irritating your wound bed, you can create more damage because you can accelerate. So you were at number 1, but then because you create this inflammation process or something, you can get almost to the step 3 just because of what you just created. So if there's no infection, you don't really need to treat the infection. Prevention is a good way, and that's where irrigation of your wounds will do fine. And now there's a lot of literature on that matter. Do I need to use sterile water? Do I need to use this? Clean water, yes. Sterile water, no. So water from your tap. So they did studies of water that's been sterilized in bottles and everything, and normal salines, and with just people taking their water from their tap, in their house. Because again, it's more like home care. Wilderness mist has not been checked very much, and as long as you irrigate with the right PSI, that's the right important, so pressure square per inch, is that this is what you need. And you need about 30 to 45, which is basically a 30 cc syringe with an 18 gauge at the end. This is basically what's going to give you the right amount of power to dislodge a lot of the stuff, and even help a little bit to prevent that that biofilm to kind of form and everything at the early stage. And so it's to clean that wound as best as you can, and then let the healing process. And so that's what it means, and that's where I want to come to, is that if you could be able to clean your water, you don't need a lot of the other products that you can find out there, like Proviodine or something like this. Does that mean you do never use those? Never say never. They have their place. But I would say probably 90 or 95% of the case, just with that, you would be okay. So with 95% of the wounds. Again, further video will talk a little bit more about specific wounds. For example, puncture wounds are more, again, because they're so deep. Even if you irrigate, the bacteria are so in a nice little cozy place yet. It's like vacation paradise for them, and they're going to grow much quicker. And so basically from your 1 to 4, you're going to go there very quickly. because they're such in place. But if it's a more superficial wound right over here and you dislodge this thing, then the other step of your continuum won't happen as quickly, and maybe it won't even happen. So that's why irrigation is the main thing to remember. And if you have one thing to have in all your wound dressing stuff, is to have that right syringe with the right tip, because smaller syringe with smaller tip won't create enough of pressure to remove all this. And that literature have really proven that it's that certain amount of pressure that you need to have. And so it's really a 30cc syringe with an 18 Ah at the end is the best device that you should. And I'll show a video of the device that I'm using now to create that pressure. So this is important. So that's where I wanted to come to. All the other products, then it depends. It's like, well, maybe, and the jury is kind of still out. It's not out yet on that one, because a lot of the studies are done like in vitro, so like in little vials or simulated skin or animal modules. But the problem is that they don't reproduce the whole complexity of a wound, because if you take a bacteria and they put it in a jar and I try a product and I see how it works, good, but how about the temperature, the vascularization, the exudate, so like how much fluid is coming out? All those components could affect as well as how my product is working. And so that's why we do trials. So in vitro it says, oh, it looks like it's going to work. And then you try it with bigger population and you're like, whoops, it doesn't work. So now, how do I know about this? Because this is when you need to start treating with antibiotics. This is the one you need to treat. But again, in this category, and that's a cool thing I've learned in that conference, when you get there, there's two ways that you can treat. You can treat locally, and at this point, this is when this where we're talking about when you're treating infection. That's when you start needing a doctor. You're past the wound management. You need like prescriptions of either ointments or things like this you need. But taking that we're sometime in the woods, what could I do to take a decision? Like, let's say you're in a 5 days hike and things like that. What could I start doing? You're in the middle of, do I come back or not? And I think this is where it can help you, and I'll put them at the bottom there. It's called the nerds. Whoops, nerds and the stones. And basically what it does is separate, and like I said, I'll put them downstairs. It'll separate. So when you're in the nerds, you're in the superficial, so you need to treat topically. And when you're in the stones, you need to treat systematically. That means that so infection can be just at one spot. So it's a little bit like a war. So either you have war in one country or you have world war. And world war, you need different approach than if it's just war in one country. Well, it's the same thing. So when you have the nerds, it's war in one country. The stones is the world war. And this is when you're starting to have to start taking antibiotics, either intravenously, POs, things like that. And over here with your nerds, you need to check your stuff. And so some of the dressing that we're going to be talking about, the beauty with them is that you can see through them. And the beauty with this is now you can assess those, and that's why it's very easy for even non-professional to check those things and kind of decide their. But again, when you get it to that stage, you're starting to talk about needing very, very like doctors and very professional care and specialists. And so I'll put the links down. They're easy stuff to check for, and just go through the list. And they're very easy, like it's like if it's non-healing, so you don't see any change after 2 or 3 days. There's a lot of exudates, meaning that there's a lot of stuff coming out. It's bleeding. There's debris that's forming. The size has increase of your wound. So when you start getting into that, it's basically trouble. It means that it's time to get out. So hopefully this was helpful, and I'll talk to you soon.